I'm Maureen McSorley. I am a board-certified nurse practitioner. I joined La Chalet when Lisa called me up and asked me, she was thinking about bringing on a women's health program, and she knew I did a lot of women's health. I actually met her when I was looking for a very specific skincare regime after the birth of my son. My skin was a mess. I researched everything that I wanted, and I saw that she actually carried the products that I wanted. So off to her location I went, and we just struck up a conversation. And this was years before I actually joined La Chalet. And she knew I was, at the time, in family practice, was loving medicine, was loving women's health, and I wasn't ready to join an aesthetics practice. So fast forward a couple years, she, out of the blue, gives me a call and says, "Hey, I want to start a women's health practice. Are you interested?" And at that time, I was ready for a change. I had been in family practice for over a decade, and I was ready to take that leap. So I joined Lisa at that time. At La Chalet, we started out as a women's health program, particularly with hormone replacement therapy. At the time, Dr. Espinoza was hearing from a lot of her clients that they were doing hormone therapy down in Florida or out in California, where that's really pretty popular. So she thought, let's go ahead and bring a program here. And as we started to really get involved in the hormone program, we realized, hey, men need hormones as well. We opened it up to being just a hormone program for women and for men, and it's just been very successful. In my family practice, I would often hear from patients, particularly women in their mid-40s, coming in with the same complaints. And that would be fatigue, weight gain, low libido, motivation, issues with sleeping, and they just didn't feel like themselves. And they knew something was wrong. So they'd come in and we'd do the testing, and oftentimes everything came back normal. And I would hear this again and again. And I kept thinking there was a hormone component to this, but we're not taught how to look for it, let alone treat it. So when she called and said she wanted to have this hormone program, I thought, beautiful. That's what I'm hearing. That's what I want to do. And today, when I see women, it's the same complaints. It's the fatigue. It's not being able to keep up with the kids. They might have teenagers that are being transported all over the place, to games, to after-school activities, to having to cook dinner, to having a job, to dealing with aging parents. It's the motivation to actually exercise or get off the couch and move. It's the issues with sleep. They would wake up at midnight. They would wake up at 2, and then again at 3 and 4, and just not getting that real good quality sleep. And then the weight gain. And the weight gain is real. It's very real. It's this perimenopausal period of time. And it's that 1 to 2 pounds a year that over 10 years, now you're talking 20 pounds, right? And that's hard to get off. And these women just come in saying, I don't feel like myself. I started having referrals from my female clients. They would ask me, hey, I feel so much better. Can you see my husband? Can you see my partner? And so when we opened it up to men, I noticed very similar complaints. And it's actually not always about low libido or sex. It's fatigue. It's the loss of muscle mass. It's the weight gain, especially around the middle. It's the motivation to exercise. It's the cognitive changes that they're seeing. A lot of men are in their 50s, and they're competing with new employees that are later 20s, early 30s, that are cognitively sharp. And they're noticing a little bit of a decline in their cognitive ability. And, low libido is in there, but it's never the top reason my men come in to see me. So the journey, when you first call, we actually will have a little questionnaire just to make sure that there's no obvious reasons that we can't treat you. And for instance, for a woman with a history of breast cancer, we have just opted not to go ahead and do hormone therapy on that particular woman. But for most of our clients that call, what we start with is getting them set up for some blood work. Let's go ahead and check hormones. And I'll hear often from women that they've gone to their primary care provider or their GYN provider and asked for hormone testing, and they were told, we don't need to check hormones, that's not relevant. So we go ahead and check. We get a baseline, we see where we're at. With men in particular, we like to know where their testosterone levels are at, what's their prostate level. And they'll come in for a consult. My consult is an hour long because I really want to get an idea as to what their journey has been, what they're experiencing, what they're feeling, what they've done in the past to see if they can, help their symptoms. And then we have a conversation together about what their blood work shows, what their symptoms suggest, and then treatment options. It's always a conversation so that they're making the decisions. My clientele tends to be, I want to say, late 30s and up. I have clients that are well into their 70s, early 80s as well. And what I like to incorporate into my consultations and with all my follow-ups is lifestyle medicine. Are you moving? Are you exercising? Are you strength training, resistance training? It's very, very important as we age. How is your nutrition? Are you getting in enough protein? Are you eating lots of vegetables? Are you getting in the fiber? So those are very important, I think, just for preventative medicine to make sure that we have a healthy nutrition, that we've got a movement program, we're exercising, we're strength training, and I incorporate that into all of my consults. There's the patients that have symptoms, that they're looking to treat a particular symptoms. For a woman, if it's night sweats or hot flashes, so those are real. If it's a man, if it's the fatigue, if it's the loss of muscle mass. And then I have a lot of patients that see the benefits of being on hormone therapy long term, more for the preventative aspects of it. They are bone, breast, heart, and brain protective. And they're looking at, whether it might be based on their family history or just in general, they want to be as healthy as they can. They're looking at hormone therapy for the long term. And the same goes with my weight management patients. When they come in, not all of my weight management patients are obese or have obesity. They are, a lot of them, menopausal, perimenopausal, maybe a man whose testosterone level is declining a little bit, but they're noticing this weight gain and they want to try and improve that. They want to try and treat that before it progresses. Our patients are with us for years, and when they come back after starting either hormone therapy or maybe medication for weight management, I hear often, I finally feel like myself again. I finally feel like myself again. I have the energy, the motivation, I'm exercising. I like that I'm watching my nutrition, and it's just great to hear those stories. I have one gentleman, after starting testosterone, he was actually going to be scheduled for a surgery on a joint. And one of the things he had mentioned was, I can't believe, not only do I feel so much more energy and motivation, my joint pain is gone. I don't need to go for surgery. And he's just thrilled with how he feels on his therapy, on his testosterone therapy. For my women, it's oftentimes they come in, they're like, I have the motivation, I've got the energy back, I feel like myself. Sometimes it's hard to quantify. Sometimes it's hard to say, I feel X, Y, and Z better. It's oftentimes I hear, I just feel like myself. At La Chalet, we are different. We spend time with our clients. That first consult is an hour long. We have a deep dive into their symptoms, into their family history, because that's very important. We need to know, what are your risk factors, right? We really get to know patients. And oftentimes, women, I can see them tearing up in the office because they're like, somebody who's finally listening to me. And we take the time, we check the blood work, we check their hormone levels, and we make sure that as we're treating them, we're seeing a change in those hormone levels. We're listening to them. How do you feel? Yes, I can see changes in the lab results, but how do you feel? Are you feeling better? And that's our follow-ups are a good 30 minutes long, just so, again, we can take another deep dive and see, how's it going? How do you feel? Are other people noticing? You know, spouses, partners, they're like, I don't feel irritable anymore. My kids aren't afraid of me anymore. And that's a nice thing to hear. You know, connecting with their partners or their spouses again, as libido goes up, and there's that connection that they've longed for, that they've missed. So those have been great to hear. Hormone therapy is definitely a journey. It's not for everybody, but it can take, I always say for women are very complex. There's different delivery methods, and delivery methods, there's pros and cons to each way of delivering the hormones. It's finding the right delivery method that works for you, the right dose that works for you. So for women, the journey can take a little bit of time. So you'll feel benefits early on, but to feel optimal, it's going to take a little bit of time, a couple of months to up to a year. For men, oftentimes, once we start to replenish the testosterone, they're going to feel those effects within a few weeks. And then it can take a couple of months to sort of get those levels steady. We do blood work just to see, okay, what does this dose get us? And do we need to tweak this dose? Do we need to change this dose? How do you feel? And we just look for, you know, any risks, any side effects that they might be experiencing. And then we have that conversation. Again, it's a partnership with my patients. So it's just seeing, you know, how they feel on their journey and going from there. At La Chalet, I love what I do. And I think my patients see that when they are consulting with me. They see my passion, and I think that they really connect with that, because oftentimes they've been not you know, disregarded by their healthcare providers with their symptoms. It's just that in modern medicine, it's more of a reactive model. Patients, if you've got high blood pressure, I've got a pill for you. We do really well with that, we really do. But when we start looking at more preventative or medicine that might be more lifestyle, they just don't have the time to invest in addressing that in the office in a 15-minute visit. So, you know, I love that I get to spend all this time with my clients, my patients, and it's definitely fulfilling. It's important for me to also stay up to date with all the changes that happen and all the new technologies that are occurring, the new medications that are coming out. So going to conferences, webinars, doing a lot of reading with research that comes out on a daily basis, that's very important.